Dr. Darien is here answering a question from one of you, and this one's from Megan G. How do I know if I have IBS, and what can I do about the symptoms?
Yeah, so IBS and IBD are often confused. IBS stands for irritable bowel syndrome. The way to think about it is it's when patients have symptoms of abdominal pain after they eat, sometimes nausea, constipation, diarrhea. It's uncontrolled bowel symptoms that they don't know where it might be coming from. Often that irritability might be due to things that you eat. It might be due to medications that you're taking. The difference between that and IBD, which is inflammatory bowel disease, is that you don't have any signs when a patient or you go under, for example, and get a colonoscopy, as we talked about earlier in this year. So how do you treat this? It's really about tracking what you're eating, talking to your provider about your medications, understanding what are your triggers, and learning about your history, and you might even benefit from a colonoscopy to better understand.
I got a question. Let's talk about NAD plus IV drips. They're trending right now.
Yes.
Do they work?
This is a DeMarco question.
This is a DeMarco question.
Yes,
You might have heard a lot about this. So what is NAD? This is an important cofactor or coenzyme to many different processes in our body that in scientific studies, in cellular studies, that topic, NAD, has been associated with biological aging, slowing that aging process. So you might see it a lot in terms of the headlines, many people grabbing for it. The problem is there's not a lot of research based in human studies. A lot of these studies are in animal studies, and there's also a possible risk. You know, NAD, if you take too much of it, it might increase your risk of liver damage. It might increase your risk in some cases of anxiety. It could even increase your risk of helping cells that don't need to be helped. In other cases, like increasing risk of cancer. Now, all of that suspicion is with animal studies, but with that being said, there are some benefits, there are some risks. You have to talk to your provider before you do something like this. This is not something that you want to get a coupon for and go out and get.
You just scared the heck out of me.
I hope, you know, I just want to inform.
Yes. Is looking a minute younger worth it in that case?
It's
your decision.
Yeah, it's up to you, DeMarco.
Not at all. I'll listen to the doctor.
My prescription for wellness is about recent emergencies that I actually commonly see in the emergency room, nosebleeds, or in medicine as we call it, epistaxis. So how do you treat that? We've got some basic things here that you can find around your house. I bring up a clothespin because we have similar tools in the hospital, but this is something that I think most of us can probably find, and it helps to stop that bleeding. So what do you do? And when you first get a nosebleed, the first thing you want to do is you want to lean forward and you want to firmly pinch your nose. And the area that you want to pinch your nose, and you can feel this, is right below where the bone ends and the cartilage stops. That is the area that you want to hold that pressure. And the goal is to hold that pressure for 10 to 15 minutes. That is a very long time. And so you want to make sure that you start a timer, and most importantly, no peeking. The point of that is to allow your body to appropriately build a blood clot to stop the bleeding. After that is done, you don't want to blow your nose because you won't want to irritate that system. You can even use things like humidifiers. And this is one of those cases where medications like oxymetazoline, the active ingredient in Afrin, might be helpful. But nonetheless, it's going to go away most likely, but red flags. If it continues to bleed despite all of that, if you have bleeding from both nostrils, that's when you need to come in and see a provider.
Man, we just learned a lot.
That was actually the best description I've ever had of how to stop a nosebleed.
Oh, thank you. I appreciate it. Well, I do it a lot.
Now I'm like feeling around for the bone and the cartilage.
I do it a lot. I do it a lot.
All right, Doc, thank you. Folks, we would love to hear from you, so please hit us up on Instagram with all of your medical questions at ABC GMA3.